Good morning, everyone. So today's we are going to see a group discussion with my students. So here the topic is the impact of data science on healthcare industry. So healthcare has transformed drastically in the last decade. So with the explosion of electronic health records and wearable devices, medical imaging and so much of data from hospitals now can generate massive volume of data every day. So, data science plays a crucial role in analyzing this information too, like to detect a disease early, to improve diagnosis accuracy, to predict patient outcomes, and personalize treatments and optimize hospital operations. So here we can see AI models using AI models with diagnosing cancers from X-rays and predicting heart attacks based on ECG signals and even helping choose the best medicines for individual patients based on their genetic profiles. So, however, these are the challenges we are facing, like privacy concern, data security, algorithm bias, and lack of trained medical data. So, today each of my students will explore different dimensions of this topic, like its benefits, challenges, ethical issues, real time applications, and what the futures looks like in this data science. Let's we see.
So myself, Vijay Durga, I would like to start with how data science revolves the core area of healthcare diagnosis and treatment. First, the data science helped to diagnose the treatment. The machine learning analyze the X-rays, MRIs, and CT scans and diagnose the tumors and fractures. And the diabetic retinotherapy was AI tools analyze the eye, scan the eye, and detect the signs of blindness previously. And also, the AI will predict the medicine dosages based on their genetics and their diseases.
Hello everyone, my name is Surya. I'm going to explain how the data science implementing in the hospital management operations and workflow. In mainly the one of the biggest impacts of the data science is not only in the clinical care but also in hospital management also. Hospital which are generate massive data of patient admissions and bed occupancy, staff scheduling and etc. In data science, the hospitals predicts the patient load of each and every patient. For example, it is taken a model that can forecast how many patients that they are arriving in the next week. For that, the management can evenly arrange the beds and ventilations, masks, and the oxygen supply also. This was extremely helpful in the time of COVID pandemic time when the hospital needed the anticipates and spikes in cases. Data science also helps to reduce waiting time of the patients and can improve the curability of the patient for their needs. In patterns in outpatient visits, hospital can adjust the scheduling time of the patient related to the availability of the doctors also. So thank you.
Let me tell about the wearable devices using data science. So as we know, the wearable devices are smartwatches and which measures the heart rate, pulse, and all. So by monitoring it's prevent the disease's early stage by easy symptoms. So we get monitored by continuously 24 by 7. So we get to know do we have a mild heart attack or something like that. So the brands used in our the Fitbit, Fast Track smartwatches and more. And the other except heart rate, we measures cardio rate and OCG and more. So the data science algorithm tracks detect irregular heart rhythms, warn users about stress level, alert about low oxygen level, track diabetes symptoms. In many cases, smartwatches have been helpful for doctors to detect in early stages. Remote patients can be monitoring used IoT systems. Hospitals use data science at high risk of diseases and before treatment focused to prevention focused. Another big development is mental health analysis, with helping the patients to communicate with each other.
So, good morning to all. My name is Ashwin. Now, I am here to talk about the ethical issues and the data collections in the clinical expertise. So, now I am here to give an example about, for example, when a person comes inside a hospital or any clinic, first of all, they collect their personal data like their name, age, and before any medications or anything do you have taken, if anything happens like heart attacks or any medication before you are taken, and they will contact to the before taken hospitals or any other clinics, and then they do collect the data from the that hospital, and they do researches on that data sets, and then the hospitals may do the research of this for the like the patient's details and how many and the medical tracks that medical tracks and the pharmacy tracks, and then their weights like their details they will take the researchers, and they can give it to the doctors like cardiologist or any other departments, and then they do decide what medications we can do to them, and then that's thank you.
So, hello everyone, myself Naveen. So, today I'm going to share how data science helps in today's modern healthcare system. So, the first one is AI helps in automated surgeries by analyzing the patient's health system over the years and what are the surgeries can be diagnosed for the patient. And then next is drug discovery. Instead of we have familiarly noticed that the COVID vaccine has been discovered within 6 months. So instead of we are using the manual way, we can use data science algorithms instead of used to discover drugs as well as vaccines for the pandemic and epidemic diseases. And then next is fully AI manageable data records. For example, in today's modern hospital history, so many of the hospitals record their patients' details manually by storing their names, details as well as health records, etc. So instead of we implement data science means it can automatically diagnose what the patient has been gone through over the years by analyzing their medical history. And then next is national level health scheme. By implementing this national level, most of the patients we can easily identify what kind of health they are availing over the years, like TB, asthma, as well as cancer or diabetes, etc.